Joan Brooks. I'm a nurse practitioner student with Georgia Southwestern University. Can you tell us what brings you in to see us today?
I've had a horrible sore throat. It kept me awake last night.
Okay.
I ran a fever yesterday of 102. Stuffy nose, headaches.
Okay. Ear
Just
pain?
yes,
Okay.
slight ear pain. Yes.
Do you have a cough?
I do have a cough.
Okay. Coughing anything up?
No, not coughing anything up. It's more creepy.
Dry.
Yeah.
Not cough. Okay. You said it kept you awake last night?
Yes, ma'am.
Okay. All right. It started yesterday?
Yes, ma'am.
Okay. So one day, 102 fever. So it came on kind of quick, huh?
It did.
Okay. The sore throat, can you tell me the pain intensity level of that? 0 to 9, 10's the worst pain ever. You tell me how bad it is?
I would say about an 8.
Okay. Is it a constant pain or is it coming and going?
It gets worse when I eat or drink anything, when I swallow. I feel like my tonsils might be enlarged.
Oh, okay.
I honestly feel like I have the flu.
Okay. Why do you say flu?
One of my children just recently tested positive for the flu.
Okay. One of your children, how many do you have?
I have 5.
Oh, beautiful. Okay. So just one of the 5?
One tested positive. 3 others are symptomatic and are being treated as it's the flu, but have not tested positive.
Oh, I'm sorry for you. Sounds like you've got your hands full at home.
I do.
And now you're feeling bad too?
Yes.
Oh, okay. I'm really sorry for you. A couple of questions. So you said you think it's the flu. Have you received any other medical care for this anywhere else?
No, ma'am.
No? Okay. All right, great. A couple of questions for you on your family history, if you don't mind. And what I'd like to know there, from your father, your parents, any siblings if you have, and then your parents, their parents, okay?
Okay.
And we're interested in finding out if they have any heart disease, high blood pressure, cholesterol, diabetes, any type of diabetes, gout, kidney disease, stroke, if they were born with any kind of childhood illnesses like cystic fibrosis, any seizure history, asthma and allergies, if they have any of that, any type of cancer history in your family. Okay, start with your mother if you don't mind.
My mother, she's healthy.
Okay, so no prior history there. What about your dad?
My dad has high blood pressure, high cholesterol, and
Okay.
he's type 2 diabetic.
Oh, okay. Does he have that controlled, do you know?
As far as I know, he has it under
Takes
control.
meds for it?
Yes,
Okay.
ma'am.
Great, okay. Siblings?
I have a brother,
Okay, how old?
24.
24, okay. What about his health status?
He's healthy.
Good, okay. Now, your mother's parents, her mother?
She's healthy.
Healthy, okay. And her father?
Healthy.
Okay, great. Your dad's mother?
She's healthy.
Healthy, okay. What about his father?
He developed lung cancer and colon cancer.
Oh, okay.
But they think that it was he was a heavy smoker for years and then he quit.
Okay.
But he also worked in a fiberglass mill. They think that contributed to him developing lung cancer and COPD as well.
Okay. Do you know which cancer started first, the colon or the?
I'm not sure about that.
Okay. All right. Is he still living?
No, ma'am. He passed away.
Okay. It's a complication of the cancer.
Yes, ma'am.
Okay. I'm really sorry to hear that. And a couple of questions, a social history about yourself, if you don't mind. Can you tell me where you were born, where you lived at growing up?
I was born in Augusta. I stayed in the general area for my entire life.
Okay, so you've lived Georgia area?
Yes, ma'am.
Okay. What about your parents? Were they married?
They were married, but they divorced when I was a couple of years old.
Okay, great. All right. What about yourself? Are you married?
Yes, I am.
Okay. And you said you have 5 children?
I do.
Okay. Tell me a little bit about your husband.
He's a veteran.
Veteran?
Yes, ma'am. He works as a lineman for the city of Sandersville.
Okay. All right. What about his health?
He has high blood pressure.
High blood pressures and take medications?
Yes,
control? Ma'am. Okay, great. All right. So you have 5 children. Tell me their ages.
12, 10, 6, 5, and 3.
Okay. All in school?
All but the 3-year-old.
The 3-year-old. So do you work?
No, ma'am.
No. Stay at home mom?
Yes.
Okay, great. And I bet that's fun with a 3-year-old. Okay. Do you have any prior history of any sexually transmitted diseases or any exposure to like HIV or any diseases like that that you know of?
No, ma'am.
No. Okay. What about any prior history of IV drug use?
No, ma'am.
No. Okay, great. Have you ever been in the military? Your
No.
husband's a veteran? No? Okay, great. All right, a few questions about your current health status. Any major illnesses or diseases?
No, ma'am.
No? Okay. What about childhood illnesses like measles, mumps, chicken pox?
I had the chicken pox, but I don't really remember what age I was.
Okay, all right, great. No problems from that though. What about any surgeries?
I had a surgery to my right hand. I sustained a bad injury to that. I had 2 plastic surgeries.
Okay. Do you have any residual effects of that?
No, ma'am.
You have full use of your hand now?
Yes, ma'am.
Okay, great. Any difficulties with your pregnancies and?
Yes, my second pregnancy, I had an emergency C-section due to HELLP syndrome and eclampsia.
Okay. Any residual problems from that?
No, ma'am.
No, with you or the baby. Okay. What about your other pregnancies? Was that the only pregnancy you had a problem with?
Yes, ma'am. The rest were
Normal
good.
vaginal
Yeah.
deliveries?
Yes, ma'am.
Okay, great. Are you allergic to anything? Any foods or medications or?
No, ma'am.
Okay. Do you have any seasonal allergies?
I do have seasonal allergies.
Okay. Do you take any medications for that?
No, ma'am.
No? Okay. What about smoke? Do you smoke?
No, ma'am. I used to. I quit
Okay. How long did you smoke, do you think?
for about 2 years.
2 years?
Yes,
How
ma'am.
much did you smoke?
I would say about a pack a week,
Okay. Okay. All right. Do you consume alcohol?
occasionally.
Okay. What's occasionally?
I would say about once a month.
Once a month? What's your drink of choice?
Beer.
Beer? Okay,
Yes.
great. Okay. Any illegal drug use or recreational drug use now? Marijuana, cocaine, or any meth or any the bad stuff?
No, ma'am.
No. Great. Do you take any current medications now?
I take a daily multivitamin. I've had some trouble with a low hemoglobin in the past.
Okay, so you did take that for extra iron.
Yes, ma'am.
Do you know how low your hemoglobin was?
I think it's been to a 7 before.
Oh, wow. Okay. And so the multivitamins help to keep that at a manageable level that
Yes,
you and
ma'am.
your other provider are comfortable with. Okay, great. All right. So you told me about the traumatic injury to your right hand. Any other history of broken bones or anything else like when you play sports in school or
No, ma'am.
anything? No? Okay. Never been involved in a major car accident or anything, right?
No, ma'am.
Okay. Any exposure to environmental hazards, like, say, for instance, do you live near a landfill or a factory of some sort that may produce a smoke or something near where you live at or might contaminate your air?
No, ma'am.
Okay, good to know. Do you know when your last hearing test was?
It was when I was in school.
Okay, normal?
Yes, ma'am.
Problems with your hearing? And what about vision?
About 3 years ago.
Okay, 3 years ago. So you wear contacts, glasses?
I wear glasses.
Okay, great. You ever had a mammogram?
No, ma'am.
No, okay. Immunization history. Can you tell me if you do the flu shot or
Yes, ma'am. I get
Okay.
the flu shot every year.
every year?
I got
Haven't
it.
had it this year yet?
No, ma'am. I got it last year.
Okay,
I
great.
got whooping cough vaccine last year too.
Okay, good. Tetanus up to date?
I've had one 3 years ago.
3 years ago. Okay. What about HPV and childhood vaccines, like when you were in school? Did you have a HPV series?
Yes, ma'am.
Hepatitis series?
Yes, ma'am.
Okay. And measles, mumps, rubella?
Yes, ma'am.
And all that. Okay. You ever had a PPD skin test where they test you for tuberculosis, like if you
Yes,
go to work? Okay. Was that negative
Yes,
as
ma'am.
well? Okay. All right. Tell me what your hobbies are. You exercise and what you and your family may do for leisurely fun?
I do exercise. I exercise every day for about an hour to an hour and a half.
For you. Great. Do you do that at home or
No, ma'am. I go to a gym.
gym?
Mhm.
Okay. Is that an activity that you and your husband enjoy together?
Yes, ma'am.
Okay, great. Tell me, as far as like safety measures for your family, do y'all wear seatbelts when you are traveling and any
No, we always wear seatbelts.
seatbelts? Okay.
Yes.
And children in car seats?
Yes,
Age
ma'am.
appropriate?
Yes,
Okay,
ma'am.
Great. All right. A little bit about your sleep habits. Can you tell me like what time your family goes to bed, what time you wake, and if you're able to stay asleep when you go to sleep?
My husband and I usually start putting the kids to bed around 8 p.m. We're usually in bed ourselves by about 10.
Okay.
I don't have any problems sleeping throughout the night, stay asleep. We usually get up about 5:30 in the morning to get everyone together and out the door for school and work.
Okay, great. A little bit about your dietary habits. Can you just kind of give a rundown of like what you would consume in a normal 24-hour period? I know with you feeling poorly from the symptoms you're describing, you probably haven't had much to eat or drink in the last day. So just tell me on a regular day what you would.
I normally don't eat much breakfast. I usually just start my day with a cup of coffee.
Okay.
I usually eat a small lunch and snack throughout the day. Then we usually eat a big meal as a family together around 6 p.m. And I'm a big tea drinker. I drink a lot of tea during the day.
Okay. You drink water too?
I do sometimes, but not as much as I should.
What about are there any food groups that you avoid? Like, are you raw vegetarian, or do you avoid certain meats, or do you do a combination of everything?
I try to do a combination of everything.
Okay, all right. Any particular diet plan you try to follow?
Sometimes I do try to do low carb meals a couple of days a week, but I can't promise I always stick to it.
Yeah, it's kind of difficult sometimes, isn't it?
It is.
Especially with kids wanting a little snack in between.
Yes.
Okay. Is there anything else that you would like to add or discuss that we didn't cover?
No, ma'am.
Now, you have any questions for us?
No, ma'am.
Okay. All right. Well, thank you for sharing your information with me. And I'm going to discuss the complaint that you have with Dr. West, and we'll be back with a diagnosis and a treatment plan for you.
Okay, sounds good.
Thank you.
Thank you.